Hello, everyone. I am Jana Marečková, Program Manager of the Canadian Accessibility Network. I'm a white woman in my early 40s. I have medium length brown hair with a little bit of red in it, and I'm wearing a black shirt today. The Canadian Accessibility Network, or CAN, is a national collaboration under the leadership of the Accessibility Institute at Carleton University that aims to advance accessibility for persons with disabilities in Canada. Welcome to today's CAN Connect Forum. Our discussion is accessible transportation in Canada. We would like to begin today's event by acknowledging that the land on which the Carleton University campus and the CAN National Office is located is the traditional and unceded territory of the Algonquin and Anishinaabe peoples, and we are grateful to live and work in this beautiful territory. Before we start, I have a few housekeeping items to share with you. Today's event is being delivered primarily in English, and we are providing captioning in both English and French, ASL and LSQ interpretation, and simultaneous audio translation to French throughout the event so that you can follow along in your preferred language. Introducing our ASL and LSQ interpreters is always a good reminder for myself and for our panelists to try and speak at an even, moderate pace, not too quickly, so that they can capture everything that is being said. Any attendees who indicated they require ASL when registering for this event have been given multiple privileges so that they can pin each of the ASL and LSQ interpreters' videos. To enable the live transcript, either go to the CC button at the bottom of your screen, click the arrow, and then click on View Subtitles or View Full Transcript. Another way to view the captions is by clicking on the links in the chat that will open in a separate window. There will be one link for English transcript and one link for French transcript. For those who would like to listen to the event entirely in French or entirely in English, you can select Interpretation, the globe icon in the Zoom meeting controls at the bottom of your screen, and select either French or either English language channel. You will be able to hear the translated audio and also the original audio at a lower volume. If you encounter any technical issues during the session, please put a comment in the chat and a member of our event support team will do our best to help you. And our last housekeeping note, for those who use screen reader or voiceover supports, we have been made aware that commentary and activity in the chat can be distracting and take away from our speakers. It is for this reason that we have adjusted our chat settings today. You'll be able to chat directly only with me, your host, as well as with my co-hosts and my event support team. Thank you for your understanding. All right, so we'll officially get started now. Accessible transportation is not merely a matter of convenience. The ability to move freely and independently is a fundamental pillar of an inclusive and barrier-free society, and one that is needed to access education, employment, healthcare, and social opportunities. Today, we would like to provide an opportunity to learn about accessible transportation and hear from our presenters, Janice Festa from Transport Canada and Tara Connolly from Carleton University's Accessibility Institute. Before we begin, I would like to invite both our speakers to introduce themselves. And we will start with Janice.
Thank you, Jana. Good afternoon, bon après-midi. My name is Janice Festa. I am a Caucasian woman with medium-length brown hair and brown eyes. Today, I'm wearing a checkered t-shirt with blue, orange, and white colors. I'd also like to acknowledge that I'm talking to you today from the traditional and ceded territory of the Algonquin and Anishinaabe peoples. I am the Director of Innovation Policy at Transport Canada. I have been with the department for over 14 years now. In my present role, I'm responsible for several files including innovation policy, northern transportation policy, and accessible transportation. Thank you.
Thank you, Janice. Tara, tell us about yourself.
Well, I'm happy to be here with you all today. My name is Tara Connolly. I'm a white cisgender woman with shoulder length hair, which is brown and I would say has a blue swish in the front. I'm wearing glasses, which is a new thing for me in the last little while. So that's an exciting little piece to me. And I duded up for you today with a red blazer. I have the privilege of working at the Accessibility Institute with a core group of amazing colleagues. I'm the Assistant Director of Research and Development, which means I get the really fun job of overseeing the many projects and research pieces that we do here through the Institute, in which we engage in with community. So excited to speak about this particular topic today.
Great, thank you, Tara, and thank you again to each of our presenters. We are very happy to have you with us today. And so we will get started with our first presentation. I will invite Janice to get started.
I think you just muted there, Janice. Just have you unmute yourself.
Sorry about that. Can you hear me now?
Yes, we can hear you.
Okay, perfect. Sorry about that. So I would just like to thank the organizers at CAN for inviting me to speak to your network today. My presentation will go over the main activities of the Accessibility Unit at Transport Canada, provide an overview of our governing legislation, touch on some of our recent research work, and explore accessibility trends we are seeing or anticipate seeing in transportation. Next slide, please. Transportation is essential to everyone's daily lives, and that includes persons with disabilities. Advances in medical care have given persons with disabilities the freedom to travel, but often a barrier-free journey remains unattainable. Additionally, the population is aging. We're also seeing an increased rate of affluent, older adults in Canada who are interested in traveling. However, at the same time, we are aware that older adults often have one or more disabilities. This slide displays some key disability-related trends we are observing in society today. Persons with disabilities across Canada and globally are on the rise. Our population is aging, and often more seniors or older adults have a disability. Of the 2.2 million persons with disabilities who used federally regulated transportation, 63% faced a barrier in 2019 and 2020. As well, the definition of disability has evolved over time to be more encompassing so that, for example, mental health and cognitive disabilities, otherwise known as hidden disabilities, are also included. From this, we can see that actions taken to identify and remove barriers and prevent future barriers will have a significant impact for all Canadians. Next slide, please. This slide provides a quick snapshot of Canada's robust legislative framework. In terms of accessible transportation, we rely on two acts: the Accessible Canada Act, which provides a more consistent level of accessibility in 7 priority areas under federal jurisdiction, including transportation, and Part 5 of the Canada Transportation Act, which enables the Canadian Transportation Agency, henceforth the agency, to eliminate undue barriers in federal transportation. Through legislation, regulations have been developed to provide clear and enforceable direction to carriers in terms of accommodations, services, communications, and planning and reporting. More specifically, these include the Accessible Transportation Planning and Reporting Regulations and the Accessible Transportation for Persons with Disabilities Regulations. The Department, Transport Canada, has also proposed new legislation through Bill C-52, which would provide additional transparency in the transportation system. To offer some background, in the spring of 2023, the Auditor General of Canada submitted a report to Parliament that looked at the performance of the agency, Via Rail, and the Canadian Air Transport Security Authority against the Accessible Canada Act, specifically in the context of the identification and removal of barriers and the prevention of new barriers. The report noted a key recommendation around improving access to data. As a result, an accessibility data piece has been included in Bill C-52, otherwise known as the Air Accountability Act, which was tabled in Parliament on June 20th, 2023. Having access to accessibility data metrics will enable the department to better identify and address systemic issues in the system. Next slide, please. At Transport Canada, we have a dedicated accessibility unit. Our unit is responsible for carrying out the government's national transportation policy objectives with respect to accessible transportation for persons with disabilities and older adults, and working with other government departments, provinces, and territories on the implementation of the Accessible Canada Act. The team provides advice in the development of policies, regulations, and programs that promote safe, secure, efficient, and most importantly, accessible transportation. As well, we work closely with the Canadian Transportation Agency to enhance accessibility in the transportation sector. This has included joint work on research projects and the publication of guidelines and documents. For example, in 2021, guidance material developed in partnership with the National Research Council, Transport Canada, and the agency was published on the agency's website to provide best practices for accessible travel during the COVID-19 pandemic. Next slide, please. The government and industry partners have also taken steps to advance and promote accessibility internationally. For instance, at the 40th session of the International Civil Aviation Organization, or ICAO, General Assembly in 2019, a working paper was presented by Canada to encourage member states to provide information to support the development of a compendium of regulations, statutes, and policies relating to accessibility in aviation. During the following session in 2022, a resolution on accessibility in civil aviation, co-sponsored by Canada, was adopted by the Assembly. The resolution requested that the Council develop a strategy and work program on accessibility for passengers with disabilities for a disability-inclusive air transport system. As a result of research conducted in Canada and internationally, the International Air Transport Association, or IATA, published a guidance document on the transport of mobility aids. The document reflects international best practices to address challenges experienced by passengers using various types and sizes of mobility aids in air travel. Additionally, following the recent G7 Transport Ministers meeting held in Japan on June 16th to 18th, 2023, member states committed to compile a report on policies and measures for each G7 member state to share solutions and encourage best practices for accessibility. Next slide, please. Technology evolves quickly, and this rapid pace of change also presents regulatory, safety, and equity challenges that must be carefully managed. As mentioned earlier, technology is improving mobility. With increased mobility, there is an increased demand for travel, both for persons with disabilities and for older adults. This is not just a domestic issue, but rather a global challenge, and one that needs to be addressed in terms of collaboration and harmonization of regulations between jurisdictions and international organizations. Finally, while we can speak to some of the trends we are seeing, we often find ourselves at a loss to provide solid evidence-based data. We rely heavily on assumptions and anecdotal evidence. Examples of accessibility incidents garner widespread attention on social media, calling on government to better direct efforts to ensure the human rights and dignity of all travelers. We know that complaints received by the agency appear to be on the decline when it comes to accessibility. However, we do not have the full data metrics. We do not know how many complaints are being resolved by operators themselves, often after media attention, or even how these numbers compare to those who actually submit an accommodation request. We hope that our new legislation will help address this issue. Next slide, please. Research on accessible transportation continues to be a priority for Canada as technology advances and new services are explored that can be leveraged in a way that is easily available, accessible, and understood for people of all backgrounds to advance barrier-free travel. This slide identifies some recent research studies we've completed through our work with Canadian academia, including creating a more accessible federal transportation system through an equitable lens, barriers for older passengers in air travel, and understanding the state of accessible taxi vehicles and shared mobility services in Atlantic Canada. The latter was a project carried out by Carleton University, and Tara Connolly will speak further to the details and results of this project following my presentation. Next slide, please. This slide demonstrates some of the complex pieces involved in advancing a fully accessible transportation system. Information requirements to support accessible transportation accommodations vary significantly across municipalities and provinces and territories, let alone internationally. Travelers need to figure out which services and rules apply where and what documentation they need to provide, when their expectation is a seamless transportation journey. Multi-level government and international engagement is needed to consider opportunities for harmonization and to improve the accessibility of transportation networks as a whole. Addressing attitudinal barriers is vital for inclusive transportation systems to ensure equal access to service and facilities. Attitudinal barriers refer to negative perceptions or biases that, whether intentional or not, discriminate against others based on their individual characteristics. Strategies to mitigate attitudinal barriers may include comprehensive and mandatory accessibility training. Competing accommodation needs poses a formidable challenge in dismantling barriers and achieving equity in transportation. That is why we must embody the principle of nothing without us to serve the needs of all persons with disabilities and ensure their lived experiences are enshrined in all decision-making. This can be done through formation of working groups that aim to develop solutions with all involved. Finally, despite Canada's regulatory regime for accessible transportation, international harmonization is at the center of creating this seamless door-to-door passenger experience that I've referred to above. We can do this by coming together to harmonize standards that leverage innovation to simplify travel processes. This could include quiet rooms, sunflower program, accessible bookings, etc., as well as implementing international best practices, such as, for example, the guidance document that was prepared by IATA, which I referred to earlier. Next slide, please. As we continue to advance our commitment to barrier-free Canada by 2040, Transport Canada will have a significant role to play. This slide highlights some of the considerations that will be required as we work towards greater collaboration and alignment on accessibility in transportation, both domestically and internationally. Forming partnerships, assembling subject matter experts, engaging in research, advancing policy changes, and advocating for accessibility at the global level can help us get there. But it doesn't end there either. We need to regularly monitor and evaluate progress of accessibility initiatives. Next slide, please. So I'd just like to thank you for taking the time to attend our presentation today on accessible transportation. Should you wish to get in touch with me, my email is listed here on this slide. Please feel free to reach out to me in the language of your choice. Now I'm going to switch to French. Maintenant, je vous parle en français. Je vous invite de me contacter dans la langue de votre choix. Merci.
Thank you very much, Janice, for such an informative presentation. We will now continue with our second guest speaker, Tara Connolly. And as Janice mentioned, Tara will provide an overview of the research project on the state of accessible vehicles in taxi services, which was conducted by the Accessibility Institute in partnership with Transport Canada. So go ahead, Tara.
Great. Thank you, Jana. So I will be presenting research and findings, but let us be very clear that this is a human story. And so while the metrics and the data and the numbers are incredibly important, one of our learnings through this was that for instance, our lead researcher who did many of the interviews noted that this was such a significant and important issue for the folks that he was interviewing, that he noted there was frustration, there was anger, there was passion. So much of this is really wrapped up in people's lives. So I think it's incumbent on us as we do research in this area that we pay attention to that lived experience and continually infusing that in our work. Great. Next slide, please. So very quickly, I'd like to give a few acknowledgements for this research. So first and foremost, folks with lived experience, the community voices that informed this. This was a piloted region, so it wasn't extensive across Canada. It was actually giving us some insight into how this type of research would go. And we found that the in-depth interviews really were a fantastic way of gaining some insights into what's happening with rideshares, taxis. So for us, it's a key tenet here at the Accessibility Institute that our work is informed by and integrated into the lived experience from community and as diverse a community as we can find. Second, an acknowledgement to the industry. So we had to have people from the taxi industry at the very least, spending some of their time informing this. And that you'll see later, there were some challenges with that, but really getting some insights from both industry and not-for-profit organizations that were providing sort of taxi type services as well. Third, I'd want to acknowledge Transport Canada, actually, around their efforts to explore and understand the availability of consistently accessible transportation options for individuals once they've completed one leg of their journey. So I think that's, we really wanted to acknowledge that as well. And then fourth, our research team. We had a lot of people working on this. We had some students, we had our researchers, we had some members of our core team here. So, and great input by all. Next slide, please. So just for an overview, the time frame we did this in was between March 2022 and May 2022. We were looking at piloting a region because we were exploring what questions were important to ask if we wanted to understand the state of the accessibility of taxis and or ride shares. So we decided to sort of pilot in the Atlantic provinces. And the initial focus was, are taxi services meeting demand? So, and you'll see as I sort of speak to some of our findings that that's only one sort of part of the question. And it's actually a little bit of a tricky question depending on how you research it. So we did a survey for the taxi industry. looking at fleet sizes in 2019 compared to 2021, how many had accessible cabs grown in terms of numbers, and what was happening with the requests. So some challenges we had was a low response rate with the taxi industry and limited accessible taxi request tracking. So not everyone was tracking how many requests they were getting. It is also tricky when you think about looking at the numbers for demand. And later on, I'll talk about a little bit around the difference between demand and need. So we did some interviews as well to sort of do a bit more of a deep dive and get a sense of what was happening for participants in their varying experiences and expertise across the Atlantic region as it pertained to taxis and accessibility. You can definitely see our reports. I've got a link in here as well. And you always can feel free to reach out to us as well if you'd like to have access to our reports. Next slide, please. Okay, some reflections. This is my favorite part. I love this part. You know, I've described, my colleague Jessie is here with us today as well, and we can speak more to the way the research was conducted if you're interested in that, but we're pretty excited to share some of the reflections we have emanating from this research. I would say it's synergistic and resonates with what you've heard from other people doing this type of research and what Transport Canada has highlighted as some issues that are occurring out there. So what we saw, of course, is that taxis and ride shares are actually incredibly important in this journey that any traveling from A to B. Certainly that accessible transportation is absolutely vital for people, and enabling that independence, the inclusion, all of the pieces that are important. It's not merely a matter of getting from point A to point B, it's really about life. So the industry here can really be part of that uninterrupted travel, or sometimes we call that seamless connectivity. And I'll give you an example. Let's say, for instance, you've booked a room at a luxurious and easily accessible, totally accessible hotel, and you arrange for, you're getting there by an accessible ferry. So all of that has worked very well, and you've gotten to your desired island. And then you find yourself stranded at the port for 2 days due to a lack of additional accessible transportation options. So you can't get from the port to your hotel. That's an example of when seamless connectivity has broken down. It can also be thought of, I think, the taxi industry and ride shares as sometimes we saw through the interviews, it could be seen as a supplement to public transportation. Let's say the hours of the public transportation are now, you're outside of those hours, that a taxi could be a potential supplement to that. And so the accessibility of those options, taxis and or ride shares, is incredibly important. You'll see me saying a lot about taxis here, simply because ride shares, like some of the companies that we have, Uber being an example of a ride share perhaps, they were very difficult to be able to assess and get a hold of. And some of them you'll find actually are not doing the accessibility in the same sort of way. I can point to, I believe Ottawa is an example of this, where that company pays a fee in lieu of having accessibility in their ride share. So that's something to be thinking about as well in those types of industries. They do claim to have some accessible vehicles, which is true, but they're not available in all cities and all places. So since we know that transportation is so important to one's dignity, one's experience of daily living, we really wanted to do an inquiry into, was it meeting the need for people? So I'll take a moment to talk about demand versus need. We can ask, are they meeting the demand? Are taxi companies meeting the demand for accessible rides? And while we talked about some challenges in actually tracking that, there's also another challenge, which is If, for instance, they're in a setting where they can claim, yes, absolutely, there's been 5 requests and we've met all of those requests. But there's only 5 requests because the service is actually perceived as not safe or not reliable or whatever that might be from the community, then the community is having to find other workarounds, whether that's relying on a family member or making alternate arrangements if that's possible, or sometimes that means foregoing the thing that they wanted to achieve or do. So in that way, we're not able to capture whether they're actually meeting the need. And we did hear a lot from our respondents about whether the options that were available to them were meeting their needs. And we heard a resounding no, they weren't actually meeting the needs entirely. And that came from both people who were in the industry, those who might run not-for-profit taxi kind of services, and people who themselves were self-advocates. So I think another important piece to look at is that the impacts on quality of life. There are multifaceted consequences when there is a lack of accessibility. And that is an impact on accessible, like essential services that someone might want to access, access to one's support systems, access to participation in social events in our community and outwards, travel, work, all of those pieces are impacted by a lack of access. So what we did end up hearing about as well, oh, sorry, next slide, I apologize. Great, was certainly that resounding piece around lack of availability. So I'm going to go through some of the barriers that came up through our research. So sometimes there was just absolutely a lack of availability. That can certainly happen in, say, a rural setting where there might be one taxi in the community. Sorry, excuse me. So it's possible that it just isn't there. So that's one reason why there's a barrier. There's also what came up is the attitudinal barriers in terms of maybe there might be some cabs that are available or transportation that's available, but ridership felt that there was a lack of disability confidence and competencies in the folks who were actually providing that transportation. Safety issues were noted at times, whether that was about how to actually support someone who's using a mobility device and to make sure that that's safely stored and that a person themselves is able to be moved in a way that is safe. So there were all sorts of issues that came up around those attitudinal barriers as well, where sometimes that actually translated into the choice not to pick up a rider who was requesting an accessible transportation. Money also was another barrier. So the financial impacts, and what I mean by that is the impacts on both an individual who might then have to choose other more expensive means of getting to and from a place of incredible importance to them, or potentially relying on family members who then take time out of work to be able to provide transportation. So their impacts on individuals and families around accessible transportation were definitely noted. As well, there were times where, for instance, again, in a rural setting, a person might choose who has an accessible cab. We had stories of, for instance, being told, well, I can't take you to that appointment, that doctor's appointment that's so very far away, because I will lose all my other fares for the day, because that's a very long drive. So those kind of financial pieces that were coming into play, and that was putting the burden on the person who is making the request, right? Like, you will cost me money. So that was problematic as well. And then there was also some of the costs for those nonprofit organizations that were trying to fill a need, who felt that they either couldn't afford to get more accessible vehicles in their fleet. There was also supply chain issues. So even if they did get some funding, which was arduous for them to try to apply for, but they were trying, then sometimes in the supply chain, they're not actually available. So it would be a 2-year wait before a vehicle could become available. And so those costs to the nonprofits, some of them saying they couldn't run in the evenings because it wasn't cost effective enough for them. All of these show, you can see where there's these holes in the fabric of what we need for accessible transportation. Next slide, please. Okay, transportation's broad impact. So what I've been speaking to you about is largely our anecdotal, like our evidence from the interviews of seeing the very wide-ranging repercussions that occur when there's a paucity or there's a lack of accessible transportation. Particularly right now, this project was to focus on taxis. And we saw how it certainly is important in this industry, but I would say we can extrapolate to say in all industries, a lack of availability is an issue. So I'm a big fan of aha moments. I think those times where information resonates with you, so that we get it in a very different or new way. And thus that information becomes transformative. So I'm going to spend a few minutes talking about impact and how we heard it. I personally, through this research, had already had insight and certainly valued the importance of accessible transportation. But through the shared stories, I had some moments of aha, which were very important for me too. So what I want to address is the assumptions that are made about accessible transportation. I'll give you a few, for example. The assumption that, well, you just have to be organized and, book these things in advance, and then you'll have your transportation need met. That's not actually the case. Certainly having to book in advance is a reality for many folks who have to access this types of transportation, but it does not guarantee that it's going to be available for them, or that will not sort of fall apart on the day. So that's a very big challenge. It's not about being organized. I think people who don't rely on this as well will sometimes think if public transportation isn't available, then you just get a cab or a rideshare. That we heard of many challenges in that as well, where even when there were accessible cabs in a fleet, they weren't necessarily always picking up the fares. And that really relates back to disability confidence and competencies and attitudinal barriers that were at play. Another assumption, oh, well, that really is very inconvenient, isn't it? So even people who are starting to get it, that sounds really inconvenient. I'd like to push us past the idea of inconvenience in this topic, and by asking a few questions. Is it inconvenient to have to catheterize yourself in a hotel lobby and staying there overnight because there's no accessible cab that can come and get you, or it won't come and get you? Is it inconvenient that you lost work due to too many times not getting there at all, or getting there late because you were reliant on a particular type of transportation that was not meeting your need? Is it inconvenient to miss an anniversary, a reunion, or other really important social events? Is it inconvenient to miss an appointment booked with a specialist that took 8 months to get to, and now you're going to have to rebook? Is it inconvenient to not show up to a presentation that you were booked to do about accessibility? Is it inconvenient to not have your wheelchair arrive with you? We know that this has just recently happened. This has been in the news. Canada's Chief Accessibility Officer, Stephanie Cadieux, spoke about an experience where her wheelchair was not with her when she got there, and she referred to it as dehumanizing. And I'll give you a quote. She said, "I want everyone to understand when a person's wheelchair is lost, so is their independence, safety, mobility, and dignity." So in this way, I think it's really important that these aha moments need to happen more and more and more throughout our society, because I think there are a lot of people, myself included, for instance, who have the knowledge and know that it's an issue, but haven't really felt it and understood it in this particular way. So I think our continued work in this area is really important. Next slide, please. So on these different barriers, we saw that the challenge is going to be that there is a growing demand on the horizon. Janice spoke to this as well, in an aging population. And here at the Accessibility Institute, we will often talk about the need for universal design, because all of us are going to experience limitations on our functioning in one way or another at some point in our lives. So designing for that accessible and inclusive participation is incredibly important to all of us, not just folks who currently identify with a disability. We saw through this research that critical role of transportation in seamless connectivity, and in this case, the cabs playing one part of that. And then we also saw how important flexibility and choice were to our participants. Next slide, please. So I spoke to this growing demand on the horizon. We saw that there were not enough in the pilot region accessible transport services to meet that growing demand that was going to only continue over time. And we also saw that there was a particular impact on this from rural places where people might be needing to access medical and healthcare pieces as they age as well. Next slide, please. One thing I'm going to speak to as well, I realize I've gone to next slide, but I wanted to speak about the lack of availability as well. Something that came up through our research was that, and I will wrap up here in a minute, that lack of availability can also create a tension or pit members of community against each other. So one example is when one part of the community had booked the accessible transportation in advance, which meant that other folks in the community didn't have access to it. And that actually pits different parts of community against each other when it's actually not about that. It's about the lack of the amount of available transportation. I think we spoke to the seamless connectivity piece. There's it becomes a moot point that some place that you're going to is accessible when you actually can't get there because there's a lack of accessible transportation. We also noted that systems were bumping up against each other. So for instance, when the healthcare system decides to centralize into, for instance, an urban environment, that means folks from rural environments need to come in for certain services. And if they don't have the transportation there, or public transportation is not enough to meet those needs, you have a very big problem and an impact on healthcare as well. Next slide, please. So we also saw that just for quality of life as well, people had a need for flexibility and choice in their transportation so that they could meet all of the various needs of their rich lives. And the fewer options there were, we noticed that our participants talked about how that actually constrained their life and what they could be doing, whether that was about their work life, their family life, their social life, their health and wellness. So those were really, really very big issues for our respondents who gave us some great information. Next slide, please. Okay, last slide. Looking to the future. I think it's really important that we talk and reinforce again the need for multiple transportation options to support that autonomy, dignity, individual health, and systems health as well. So training was really something that came out, the need for training and increased skill sets among folks who offer transportation, universal design as being essential, those systems coordinating in planning together, and then making sure sometimes that we might be using some reinforcers or some levers to make sure that companies who are providing these services are actually providing them. So it's not just a matter of issuing licenses to be an accessible taxi, it's to actually have something that make sure that they are utilizing those. So I'll give you some examples that you could check out as my last sort of little bit. In Calgary, they were implementing something where they were trying to have a reinforcing system for all their cab drivers. So once you met a certain amount of fares that you had picked up, you get to another level. So there was a reinforcement system. In Toronto, there are a few cab companies that are really starting to take a leadership role in how to provide service, although we do see certainly in the media, as Janice showed, that there are still issues with transportation in those large settings. And then a lot of our respondents asked about, well, certainly one of them, and I've heard it anecdotally myself, why can't we get to a place where there are, for instance, accessible cabs just always throughout all the fleets? So an example looking to, for instance, London. So I look forward to any questions that you might direct towards us. If we don't have time today, please feel free to reach out to us. We'd be very excited to chat with you about this. Thank you.
Thank you very much, Tara. It's fascinating to learn about the research fundings, including the assumptions, challenges, and barriers, and examples of solutions. And I think it's very important to realize how the lack of accessible transportation options can have a huge impact on one's life. Okay, so we have a few minutes now for discussion, and we will now invite questions from our audience. If you have any questions or comments for our guests, please type them in the chat. If you require ASL or LSQ interpretation to ask a question or share a comment, please raise your hand and we'll spotlight your video and invite you to ask questions via ASL or LSQ. For any attendees who are joining us over the phone, the controls you can use to interact with us during the Q&A period are *9 to raise and lower your hand, and *6 to mute or unmute yourself. So again, if you have any questions, please type them in the chat or raise your hand. Okay, so I will read the first question. How can transportation service providers ensure persons with hidden and invisible disabilities receive the support they require while balancing the need to respect their privacy? So who would like to answer that question? Janice, would you like to go first? And then Tara?
I'll jump in really quickly, and then Janice, feel free to add more and enrich it. I think, so thank you for bringing up that question, because the hidden piece, the hidden disabilities and things that are less visible are a challenge in many respects in many areas, and in transportation certainly the same. So some of the ways I think that we heard through our research were again the training and the preparation. So it's not so much having to identify oneself as actually getting that design in place in advance. I realize that's easier said than done when you already have some systems in place that people might have resistance to changing. But we did hear that it's that education piece. One of the challenges is that in the taxi industry, there are certain standards or types of trainings they're supposed to take. That is slightly different than in the Uber kind of scenario and other types, sorry, to other companies. Uber's the only one I'm thinking about right now, but for ride shares, they don't have the same recommendations. So where Janice had spoken before about sort of getting same page around requirements and certain standards, I think that would be a really important piece. So Accessibility Standards Canada, like looking at sort of the idea of transportation, and then hopefully modeling that for other industry. I think we definitely have to get industry on board with that as well too.
Go ahead, Janice.
Yeah, so I'll just jump on. I wanted to invite my team to join as well. I have a couple members of my team that are here with me today, Stephen Winters and Leah. And I think Stephen might have had to just jump out, but Leah's joined us on screen. Oh, Stephen's still there. Wonderful. Stephen, did you want to jump in to answer this one too, or did you want me to take care of it?
I think just, I mean, I can kind of speak to it from the point of view that from our perspective, we know it's a delicate and important issue for service providers to have to deal with, you know, when we're balancing accommodations and also at the same time respecting privacy matters. It's always important to kind of weigh those together to ensure that transportation service providers are able to provide accommodations, because at the end of the day, if there is no disclosure, then there's not much that can be done that's not obvious, except that, and sort of speaking to Tara's point, where transportation service providers, for example, airports is a good example, they can create environments or policies that kind of think ahead of the issue so that the accommodation is sort of already there. For example, communication on websites is a big one. The kind of spaces that you can use in certain environments that you know, quiet rooms that people can make use of and so forth. That kind of means that you don't necessarily need to disclose your needs always. In some cases, I think you will. We see this often in the air industry, for example, if people are traveling with emotional support animals. This is an issue that is very contentious in this space, but people bring their animals on board, and obviously the airline needs to know what this is about, right? It's not as obvious, like let's say as a service dog, for example. So there is a certain amount of disclosure that might need to take place, but ultimately it's finding those ways to try to address in advance the needs and not to necessarily pry it from people, kind of thing. I think that's maybe what I would add there. Like it's a kind of a balancing act, and I think we're getting better in that respect. I think we're seeing a lot more awareness. There's programs out there, for example, the Sunflower Lanyard program that's being used that gives people sort of a non, what's the word I'm trying to look for? It's signaling that this person may require attention, but it isn't necessarily putting the spotlight on them. It's just a highlight. Yeah.
Stephen, I think the to your point too there, the idea of starting to get all industries ready to ask the question, what can we do to support you? Meaning everybody, what can we do to support you? And making that a normalized thing versus a state what you need. And so anyone, make yourself an outlier and state what you need. Actually, no. So it's within
Absolutely.
systems as well to make it very normed that if we're always going to be asking, how can we support you? And that's your way to speak about how, without even having to talk about diagnoses and private health information, and without having to single oneself out.
Yep. And there's also, you know, there are different jurisdictional requirements as well. Like in Canada, I do know like our regulations are more built in a way that it is good to disclose to get the accommodations that you're entitled to, human rights. But say, for example, in the US, it's much more privacy driven, but there's other reasons for that. And you could talk about like the medical industry, insurance and so forth. So confidentiality is more of a priority in that space. So like there's also those kind of conflicts that we're seeing, not conflicts, but inconsistencies as well.
Great, thank you all. We'll go to the next question. What would you say is the definition of an accessible taxi ride? Are you mostly talking about physical accessibility in your review with taxi companies? I would, Tara, do you want me to take this one?
Yeah, and I can sort of shout out to Transport Canada, who were very open to whatever we were going to find in terms of meeting the need. They were very open to saying, like, is it about counting? Is it about wheelchairs? Is it about, because we have, through the Institute, we see it as a very comprehensive view of accessibility pertains to all sorts of different experiences. So no, it wasn't just about, it was something wheelchair accessible. That certainly was one way to do some counting, because that's primarily now what designates someone as an accessible CAP. But we were actually asking about things like sensory environment, if you're talking about folks who might have sensory needs, communication, signage, all of those parts to the ride, and even an understanding around what were the experiences of attitudinal barriers in the experience of the ride itself. We did hear some things that we didn't just focus on what wasn't working. We did ask what has worked as well too, but certainly I'm highlighting today's a lot of the pieces that were very big gaps for people, which were impacting their lives at a very significant level. And I think a lot of respondents felt that they were shouting into the void, if that makes sense, like that they didn't feel that there were enough people who get it yet.
Great, thank you, Tara. We have time for one more question, so I'll ask Carrie, who has her hand up, to ask a question. Go ahead, Carrie.
Hi, thank you. My name is Carrie, and I'm a board member of the Ottawa Transit Riders, and I support the Para Parity campaign, which is an advocacy group that advocates for more accessible transit in the city of Ottawa. So I was really interested in your presentation, and I'm just wondering if you know of any groups or any studies that look at successes in different cities on different issues, and whether there's any sort of resources, because I personally would love to be able to point to a city and say, hey, this city is doing a better job. This is what they're doing. You mentioned, for example, Calgary providing a sort of reward for taxi drivers. And that's the first time that I've heard of that. So I would really like to know if your group or a different group or other researchers have sort of a list of success stories and tactics that have worked really well so that we can push that in Ottawa.
I'll start off, Janice, and I don't know if you folks have, because you're working at sort of federal level, but you might have highlighted some things too, I don't know. So from our perspective, thanks, that's a great question. So we did concentrate on the Atlantic region. So we had more information about that, but through the research, you know, it's very fun to nerd out on these things and start to get involved with where we're seeing good things happen. So that's where we drew in some of those examples. So for instance, now I can't even say if the Calgary one is still continuing or not, but I wanted to give you some guideposts to look at. I'm more than happy if you want to reach out to us actually to discuss and kind of go into a few of the examples we did see. There are certainly some examples internationally of it being, you know, in terms of design, and there's definitely some examples and learnings at different places in Canada for sure. Yeah, there's a company that actually was at the Rick Hansen conference last year that was really speaking to what they're doing. Their entire, I think it's their entire fleet is accessible, and they keep pushing with that, which was great. So I'd love to put you in contact with them.
Great, thank you, Tara. Thank you everyone for your questions. We have a few more, but what we will do, we will ask our guest speakers to respond to the questions in writing, and then we will share those responses in our post-event email. Before we end today's event, the CAN National Office would like to sincerely thank both our speakers, Janice and Tara, for their time. And we are excited to announce the topic and date of our next CAN Connect Forum. Our next event, Entrepreneurship in Canada, Perspectives from People with Disabilities, is coming up on November 14th from 12 to 1 p.m. Eastern Time. And we invite you all to register. We will be sharing the link to register in the chat. We will also be sharing a link to our feedback form, which we ask that you please fill out to help us keep developing and improving these CAN Connect forums. Thank you all for attending today. If you have any questions or would like to receive information about getting involved in CAN, please contact the national office at can@carleton.ca. This email address has also been shared in the chat. We hope to see you all at our next CAN Connect forum in November. Thank you, and have a great afternoon.
Thank you.